So I'm going to use this document here as a review. So I'm going to zoom in because it's probably really small on your screen. So let me zoom in here. You guys able to see that a little bit better? All right. So I made a couple updates to this this weekend. But so basically what we've been talking about this entire unit are our 4 pillars of image quality. And those pillars are contrast to noise ratio, signal to noise ratio, spatial resolution, and scan time. And when we're dealing with MRI, a lot of times we like to say with our parameters, we get a lot of trade-offs where one will increase and then say signal will increase, but then your spatial resolution might decrease just because of what happens to your voxel size. So I put over here what those definitions are, just as a good reminder. So your contrast by definition is the difference in signal to noise ratio between 2 adjacent pixels. So it's basically your eye being able to detect the contrast between 2 tissues because they have different signal intensities. Is this able to be measured or not? What do you think? Can we measure contrast to noise?
No.
Good.
Only signal.
Only the signal. So I would put that off to the side that you cannot measure contrast and noise. Only signal can be measured. So by definition with signal, it's the ratio of signal amplitude, which is predictable because we can change that up and down by adjusting our voxel size and some other parameters. So it's the ratio of signal amplitude, which is predictable to the average amplitude of noise. And noise is going to be random. And where does noise come from? Where does noise in your image come from?
From the patient, but it's random.
Okay, the patient's one place where you get noise, but also the environment, the room environment. So scan the zone 4 room environment. That's where noise could come from. And also the system, so your MR system. So the bore of the magnet could also produce noise on your image. So those are the 3 things where noise can generate from: the patient, your system, and even just the room environment. Spatial resolution by definition is the ability of the imaging system to detect 2 points as separate and distinguishable. So the definition for spatial resolution is no different from X-ray. So can I distinguish 2 specific points? If you're looking at an image, if you have a grainy image, you have low SNR. Sometimes if you have what we call a blurry image, you have a bad spatial resolution. So you should be able to distinguish the outer edges of, say, like the ribs or the liver or whatever structure you're trying to look at. If you have a very distinct line that outlines that structure, you have good spatial resolution. But if that line starts to blur a little bit, your resolution might be decreasing. Scan time is the last pillar of image quality. We want to reduce scan time so that we prevent any motion on our images. And we know we have certain restrictions with some patients in terms of breathing and claustrophobia, things like that. But we still have to get good image quality, so we have to wait a good amount of time to fill K-space. So scan time is the time to fill K-space. And to solve for that, it is TR, our repetition time, times the number of phase encoding steps, times next. What's another acronym for next?
NSA.
Yeah.
NSA. So I would put NSA right there. NSA is also another acronym for number of excitation, number of signal averages, and then you might even see number of acquisitions, which is a Phillips scanner. But they all mean the same thing. Our phase encoding steps are typically the smaller number of the matrix. So if you have two numbers that create the matrix, if you have 256 by 128, 128 is going to be your phase encoding steps because you want the smaller number to be associated with the smaller axis of the anatomy. So you'll see an example of that with the problems we work here in a little bit. We have three equations to solve for scan time. The first one is what we call a 2D conventional spin echo scan time. And that is TR, time phase encoding steps times next. So basically the time to fill K-space because we're not doing multiple slices. But if we're doing multiple slices and getting what we call a 3D volume imaging or volume acquisition, we take that original equation and then just multiply it by the number of slices, not by the slice thickness. Make sure you put that in the notes right next to it, not by the slice thickness because they'll try and confuse you on the registry. It's the number of slices. And then finally, we have what we call a fast spin echo. That's what that acronym stands for. FSE is fast spin echo. So when we have a fast spin echo, we have multiple 180-degree refocusing pulses, which create multiple echoes during a TR. And that allows us to fill multiple rows of K-space per TR. So our equation is the original TR times number of phase encoding steps times next, all divided by your echo train length. So fast spin echoes typically are a lot faster than your conventional spin echoes because you divide it by your echo train length. So whatever that number is, if it's 8, 12, it's going to reduce your scan time by that number. Okay. So then we go over here. Any questions about the 4 pillars of imaging and the scan time equations? So make sure you know those definitions, make sure you know what the 4 pillars are, and make sure you know the scan time equations. All right, signal to noise. Once again, signal is predictable. We can measure the amplitude. Noise is random, and it comes from the patient, the scanner, and the room. Typically, SNR is really just the hydrogen protons within a voxel of tissue. So if we have more hydrogen protons, we're going to get more, a larger net magnetic vector, and we're going to get more signal from that tissue. So let's go down each of these parameters and see how it adjusts your SNR. And I want you guys to give me the reasoning behind it. So if I increase my strength of magnet going from a 1.5 to a 3 Tesla, why does that increase your signal?
An increase in B sub 0 increases SNR.
Okay. But
because the vectors are longer or stronger.
okay, yeah, and it really has to do with this next line because you have more energy of the static magnetic field, so those spins are going to align with B sub 0 at a higher rate. So you're going to get more low energy spins compared to high energy spins, which can oppose the static magnetic field, and that creates a larger net magnetic vector. So these two you can almost associate with each other. The reason our strength of magnet increases and our signal increases is because our net magnetic vector increases. Number 5 here, row 5. High proton density areas like the pelvis or the brain that has a higher SNR. And that, you know, I don't really think I need to ask you guys that, because it's just you'll have more hydrogen protons coming from that tissue. You can excite more hydrogen protons with that particular tissue compared to like an area that has low proton density, like the lungs. Or what are some other areas that have low proton density?
Cortical bone.
Cortical bone, lungs, tendons, ligaments. So put that off to the sides. Not only lungs, but tendons, ligaments, cortical bone, anywhere there's metal. All right. If our voxel volume increases, our signal increases. What's the rationale behind that?
There's more protons in the area.
Perfect. Simple as that. There's now more available hydrogen protons to excite. So that kind of goes along with row 8, a coarse matrix. A coarse matrix means our voxel size is going to be large. So we have more available hydrogen spins to excite. But you have to clarify, and I'll always clarify on the exam, if the field of view stays the same. So if your field of view, your big rectangle that surrounds the matrix stays the same, but then you have a coarse matrix, meaning the number of your matrix actually goes down, you're going to get higher SNR. And just the opposite is true for fine matrix. So if I had a 350 by 350 compared to a 125 by 125, which one would be considered a fine matrix?
$350.
350 by 350. So the larger numbers are going to create a fine matrix. Good. All right, number 10 or row 10, field of view. If I double my field of view, my signal is going to increase by 4. And what's the rationale behind that?
Because you doubled it on the length and the width.
Good. Or you could say in MRI terms, the phase encoding direction and the frequency encoding direction. Good. So that's going to increase by 4. So I highlighted this and I said this has the greatest influence on signal to noise. So just like when you're looking at a house, if you increase the dimensions of a room on either side and you double it on either side, your square footage is going to increase by 4. What do you think if you tripled your field of view? What happens to your signal? If you tripled your field of view?
It increases by 6.
It's not going to be by 6.
Well,
Nope. So the reason we get 4 here is because we square 2. So what's the square of 3?
Wouldn't it be 9?
9. So you could put that off to the side. If we triple field of view, our signal now increases by 9. Because you're squaring whatever your field of view is. Okay. Row 11, if our slice thickness increases, our signal increases, and that's just dealing with voxel size. So if we have more available hydrogen spins, we're going to be able to excite, we're going to get an increase in signal. Same with number 12, we're just thinking two-dimensionally now. So if for some reason the test says you increase your pixel size, you're going to increase your signal. "13, your phase encoding steps increase, but your field of view remains the same. What happens to your signal?" It says
Nothing.
it says
More noise.
it says it decreases, but why?
Is there more noise?
Mm-mm.
Does the phase encoding steps decrease?
So in this scenario, it
Increase.
says phase encoding steps are increasing.
Is
So
it scan time?
No, well, I mean,
that increases
It'll create-
SNR because it's part of the equation.
no, you get don't think scan time because all we're
Oh,
at
I'm thinking scan time, yes.
SNR. So what that means is our phase encoding steps increase, so our matrix of the phase encoding axis is going to increase. So just your matrix is going to increase. And when that happens, you get smaller pixels or voxels, you're going to get less SNR. So don't get confused by that term phase encoding steps, because you automatically want to go to your scan time, but here it's just asking about signal. So if your number of PEs increase, you're going to get more rows of K-space, which means your voxels are going to get smaller. And that's why I had to say here, if your field of view remains the same. And that could be a little tip, that if I have something here that says if the field of view remains the same, I'm talking about the matrix size. All right, row 14 here. It says TR increases, your signal increases, yes, but up to a certain point. So tissues can't recover past 100%. So if you've allowed the tissue to fully recover, once you've hit 100%, there's really no point in extending your TR past that, because it hits a plateau. You can't go any higher than 100% recovery. So there's no point in extending your TR and keep extending your TR, because that's just going to mess with your scan time. So as long as that tissue is fully recovered, then you're going to get maximum signal. All right, row 15, TE. So this is an inverse relationship. So as my TE increases, why does my signal decrease?
More decay.
More decay, more signal decay. And I just put that off to the side here. More time for the signal decay. So we're thinking the T2 decay curve now, instead of above here, the T1 recovery curve. So if it helps you guys remember, draw the T1 recovery curve and draw the T2 decay curve for those lines. Row 16, flip angle. As my flip angle increases, I put here my signal increases up to the Ernst angle. So that is the most correct statement. But what we've learned so far is really dealing with spin echo. And I put over here, for spin echo, the optimal flip angle is usually 90 degrees. And that's because our net magnetic gets flipped 90 degrees into the transverse plane. It's rotating around that axis, and it gives us the largest signal amplitude. But if you are concerned about what Ernst angle is, and by definition, it is right here. Ernst angle is for any given ratio of TR and T1 relaxation time of the tissue, there's an optimal flip angle that will give the strongest signal. So that's really talking about saturation effects. So for each tissue, you actually do have an optimal flip angle, So when your TR is extremely short with a gradient echo, sometimes we have to reduce our flip angle to get optimal signal. So this is really just dealing with what we call gradient echo pulse sequences. So this first part right here, if you just want to highlight it up to the comma, the semicolon here, you could just say this applies for gradient echo pulse sequences. But the most correct statement, and what you'll see on the registry, is if our flip angle increases, our signal increases up to the Ernst angle, which is just the optimal flip angle for a particular tissue, for a given TR. All right, the next row, 17. If my NSA increases by 4, what happens to our signal? It's going to double, because it's not going to increase by 4. It's going to be increased by the square root of whatever our NSA is. So it is not the most efficient way of increasing your signal. So field of view is way better at increasing signal than bumping up my NSA. And NSA is part of the scan time equation. So if you bump up your NSA by 4, you only get an increase in signal by 2, but your scan time is going to increase by 4. So one of those trade-offs. Echo train length. So as my echo train length increases, my signal will actually decrease, because we actually get what we call more noise or blurring on the image compared to signal. So our noise increases here. And what's happening is really we have a lot of echoes during one TR period. And as you get more and more echoes per TR period, our signal amplitude of those echoes slowly decrease. And what happens is those low signal amplitudes get placed in the outer edges of K-space, which is your spatial resolution. So you don't really need to know this one for the test, but this is why when somebody increases their echo train length, your signal drops. Your scan timing goes down, which is a good thing, but your signal drops because you get more noise, which causes blurring. Row 19, if I increase my phase oversampling, I'm actually going to increase my signal, because we're actually just exciting more hydrogen spins. We're going to increase our phase encoding steps, and we're basically going to increase the area of tissue that we're exciting. It helps with what we call wraparound artifact or aliasing. So you can put that off to the side. The advantage of this increasing phase oversampling, it helps prevent wraparound artifact or aliasing.
Because I thought it helps with aliasing, I thought it would then take out noise.
No,
So that was my automatic thought, because then there's not stuff competing.
no, I mean, the stuff competing is just signal from the tissue. So that's not technically noise. It's just that signal from the tissue is getting mismapped into the wrong place. So it's not noise per se. It's just an artifact. So when the artifacts aren't really noise. They're just sometimes an error caused by, something going wrong in the system, or that the technologist didn't, compensate for it, I guess you could say. Because noise is random, and noise we cannot predict. But tissue wrapping into the image is something that we can actually predict and compensate for.
Gotcha.
Using partial Fourier. So I don't know if you guys remember this from back from K-space and talking about the different ways that we fill K-space. Partial Fourier basically means we fill an area K-space, and then since K-space is symmetrical, we just basically copy and paste it down in the other part of K-space to fill it faster. So our signal actually decreases because only a portion of the data is truly collected, and then we just basically copy and paste it. And remember, noise is random, so that noise could end up anywhere within that area of K-space. So you don't really get a true assessment of the data when you copy and paste that data. It helps with the scan time though, which is good. When we use parallel imaging, so you might see this called IPAT or sense on your scanners. So if you say, I would put off to the side here, IPAT or sense, that's a parallel imaging technique. And you need to have a coil that is parallel imaging compatible. And what happens here is our signal decreases and our scan time decreases. So one good thing, one bad thing. And the way that the scan time actually increases is because we have what we call these acceleration factors, and we have coils associated with each line of K-space. So you're actually going to fill each line of K-space with a select receiver coil built in with this parallel imaging receiving coil. This one, you're not really going to need to know for the test. So I would say phase oversampling, partial Fourier, and parallel imaging. This is good for like when you've become a full-blown technologist and you might have an, you're trying to figure out what happens to my signal when I adjust these things. But these are like more advanced. We did talk about having a narrow or reduced receiver bandwidth and what that does to our signal. And what happens is our signal amplitude actually increases because we filter out the noise. So our noise typically looks something like this, where it peaks in the middle and then it kind of trails off at the beginning and the end because it's rephasing and then dephasing. So if we create a filter where we eliminate all this area on the outside by creating a narrow receiver transmit bandwidth, we're going to increase our signal to noise ratio because we've now eliminated some of the noise. So here I just said it increases, and if you make your receiver bandwidth half as narrow, you're going to increase your signal by the square root of 2. And what we're doing here is really just filtering out the noise.
Was this where you were talking about the rectangle?
No, not yet. That's rectangular field of view.
Okay.
All right. Row 23, we talked about all the different coils and what it does to our signal. So if you have a quadrature coil, how much does your signal increase? By how much percentage?
40%.
40.
30%. That's where it gets its name, quad. So we have two receiving coils at 90 degrees from each other, and that increases by the square root of 2, which is 40%. And then I would also put here, obviously phase array coils also increase signal because you have smaller coils going down compared to just one large coil. So that's how it increases signal. And then if you have smaller surface coils, your signal also increases. So it's almost counterintuitive. You would think the big abdomen coil would get more signal, but really you're able to image a larger field of view with it, but your signal actually decreases. So the smaller surface coils actually increase your signal. And if you had a surface coil of a diameter of 6 centimeters, what depth does it go down? 3. Tisha's holding up 3. Good. If our number of slices increase, our signal is going to increase just because we're exciting more hydrogen spins. The only thing here to remember is the number of slices during an acquisition or a TR are limited due to tissue heating. So we can't actually fill every slice per TR because our patient would heat up too much sometimes. So that's why sometimes when you really reduce down your TR, sometimes it says, oh, do you want to change your number of slices, things like that. So it's just a good reminder that you can only really fill a certain amount of, or image a certain amount of slices per TR. Row 25, volume imaging versus 3D. And 3D is really talking about slabs versus slices. So here, when we're dealing with slabs versus slices, a slab of tissue covers a larger field of view or larger area, and you're able to excite more hydrogen spins compared to a slice that is just a smaller area. So you have more available hydrogen spins within a slab compared to a slice. Slice gap. What's a typical slice gap? What percentage?
10%.
10% on the low end, 10 to 30% typically. So slice gap, you need a slice gap to prevent what we call that cross excitation artifact, which is noise. So if we reduce the amount of noise in our image by having that artifact, we have now increased our signal. So we were able to compensate for that artifact and eliminate that noise. Just like with narrowing your receiver bandwidth, we compensated for eliminating that noise by narrowing that receiver bandwidth. So the slices no longer overlap. And remember, the slice profile is more of a bell-shaped curve compared to a perfect rectangle. So they start to bleed into each other. Spin echo versus gradient echo, you're going to get more signal from a spin echo. It's going to be a lot longer sequence time-wise, but you're going to get more signal. And the reason for it is over here. With spin echo, all the longitudinal magnetization is converted into the transverse magnetization plane because you typically have a 90-degree flip angle. So that net magnetic vector gets completely flipped down into the transverse plane. And gradient echoes typically, because we have really short TRs with a gradient echo, typically have flip angles that are smaller than 90 degrees. And we always, from our PowerPoint, we know that 90 degrees typically gives us our optimal signal for a spin echo. I also put here, spin echoes have these 180-degree refocusing or rephasing pulses, which is more efficient at boosting our signal back up than our gradient rephasing. T2 weighted versus T1 and proton density weighted. T2 has less signal because they have longer TE times. So more time for the signal to decay on a T2 weighted image. Which one has the best contrast to noise out of these weighted images? Which one has the best contrast to noise? T1, T2?
T2?
T2, and why, Rachel?
Does it have to do with being able to see the CSF, or I don't know?
Yeah, because fluid is bright and a lot of pathologies are going to be bright on T2. So you're able to see it with your eyes, see the contrast with your eyes a little bit better with a T2 weighted compared to a T1 or a proton density. So you could say contrast to noise is best with the T2 because the best CNR. So T2's bad SNR, but good CNR. So those are basically all the parameters that we can change on your MR console in terms of signal. So when you guys go to clinic, I suggest maybe printing this out and having this available so that if you are struggling to get more signal on your image, these are some of the things that you can adjust to improve your signal.
I see you're recording this, so we're gonna have this where we can rewatch it.
Yeah, but I'm also, there's already a YouTube with me going over this one also on Canvas.
Oh, cool.
All right, now let's get down to resolution. And we already defined what resolution was up here, the ability of the imaging system to detect 2 points as separate and distinguishable. And what happens if we really want to just quickly break it down, it's basically the size of the voxel. So resolution is determined by the size of the voxel. So if our field of view increases, but you have to put here, matrix stays the same, our resolution is going to decrease because our voxels are going to get bigger. Okay. If I increase my slice thickness, which is associated with the voxel depth, my resolution decreases. If I increase number of pixels, but you have to put here, field of view stays the same, my resolution increases. Because if you increase your pixels, you're going to increase your matrix. So that corresponds with the next row. But you have to put over here, field of view stays the same. All right, this rectangular field of view can be tricky sometimes, but what we're doing, we're not talking about a rectangle pixel. A rectangle field of view means that we're going to be imaging an area that is long and narrow. So put off to the side here areas like a sagittal L-spine or a tib fib or a femur, just like areas in the body that are long but narrow. So what we're going to have is square pixels within that rectangle field of view, and we're going to eliminate some of the phase encoding steps. So a rectangular field of view still has square pixels, so good resolution, but it's also going to reduce scan time because what we do is just eliminate some of the phase encoding steps around the anatomy that we don't need because it's a very narrow structure. So just put off to the side here, scan time decreases, resolution stays the same because we're using square pixels, but our scan time decreases because we eliminate phase encoding steps. That's different from this last line here. We're talking about the actual pixel size, not the field of view. If you have a square pixel versus a rectangle pixel, you're going to get a better resolution with the square pixel, meaning we have equal dimensions on two sides. And that's going to be better for reformatting or MPR, multiplanar reconstruction or reformatting. And then the last row, 37 here, one we skipped. If we have a steep gradient slope, meaning we pump more current through that particular gradient, it creates a steep slope. A steep slope gradient is going to create more phase encoding steps because we're going to get a quicker change in magnetic field strength along that gradient. So as we increase the phase encoding steps, phase encoding is one dimension of your pixel size, you're going to get smaller pixels. So you're going to get better resolution. Over here, I put the formulas for pixel size and voxel size. Pixel size is the field of view divided by the phase encoding steps times the field of view divided by the frequency encoding steps, and your unit should be millimeters squared. Make sure if they provide you with a field of view in centimeters to convert it to millimeters first. To calculate the voxel size, it's the pixel size times the slice thickness. Because over here we said slice thickness is the voxel depth. So now we have 3 dimensions, so our unit should be millimeters cubed. And then I just put here the definition of what an isotropic voxel is, and it's a 3D volume of tissue with 3 equal dimensions. So all 3 dimensions are the same size, which allows us for really good reformatting. All right, so let's work some problems here. So go to this particular document and let's determine what the scan time is going to be. So here it says a fast spin echo sequence. So which equation should we use? It says fast spin echo.
The fast spin echo sequence formula.
So what is that?
TR times the number of phase encoding times the number of NSAs over the ETL.
Perfect. So we need to find those. So when I solve for these, I always like to highlight the things that I need, and then I just don't even worry about the things that I don't. Phase encoding steps is, remember, the smaller number of the matrix, so 224. You need your echo train length, and you need your next. Okay. So 2500 times 224 times 4, and that all is divided by 12. And your answer should be in milliseconds. So what do you guys get there?
$186.6.
Okay, so that's in milliseconds. So now we have to get it in seconds. So we have to times it by 1,000, right? So how many seconds is that?
1086. I'm not 1000, sorry, 186,600.
Okay. I think I went the wrong way with my decimal. I think I need to divide it by 1,000. When you go from milliseconds to seconds, you need to divide. So what's this number? I'm sorry.
I divided by 1,000 already when I gave you the number.
Yeah. So what did you get?
Is it 0.1866?
Okay. All right. And then it says, now we have to get it in minutes.
I have a question.
Yeah.
When I did it and I gave you 186.6, I had already divided by 1,000.
Oh, okay. Okay. Sorry.
That's why I was really confused.
Yeah. And I was looking at my data. Okay. So can somebody get me, before we confuse people, this number right here?
It's 186, comma 666.66. 186,666.
Like that?
Yes.
Okay. Just divided by 1,000 seconds. Okay. So most of these are going to be answered in minutes and seconds. So now we have to get it in minutes. So we divide, there's 60 seconds within a minute. So we divide it by 60. So what's that number now?
3.11.
30.11. Okay. So the answer is going to be 3 minutes and something. But this is in terms of minutes, this 0.11. So don't answer it as 3 minutes and 11 seconds, because this is just 3 minutes, 0.11 minute. So now we have to multiply this 0.11 times 60 again. It seems confusing, but now we're only in minutes, so we need to get it from 3 minutes, 0.11 minutes to 3 minutes and whatever seconds. So let's multiply 0.11 times 60, and what's that number?
6.6.
6.6. So your final answer should be 3 minutes and let's round up 7 seconds. Okay, so you can see here it's a multi-process problem. And sometimes the hardest thing to do is to remember to multiply that last little bit of decimal behind the 3, multiply that 60. Because on the registry, they'll give you 2 answers that are close. So they'll say 3 minutes and 11 seconds and 3 minutes and 7 seconds. And the correct answer is 3 minutes and 7 seconds. Because this 3.11 is, the units is minutes. Okay. So let's work another one here. Here, they're saying it's a 3D. So that should clue us into which equation we should use. So what is the equation we should use?
The volume imaging, so TR times the number of phase encoding times the NSA times the number of slices.
Okay. So which number right here should we use? 176 or 256?
$176.
Good, Marcadia. The smaller number, always the smaller number. If they're equal, if they're the same number, you choose, like if it was 256 by 256, you just choose 256. All right, next is 1, so we don't really have to multiply by anything. but then Tisha said we have to multiply it by the number of slices. So they see how they gave you slice thickness? You don't need that number. So our scan time equals 24 times 176 times 1 times 76. What's that number we get?
$321,024. 0, 2, 4.
Like that? And once again, that's in milliseconds. So to do the quick math from going to milliseconds to minutes, we could just multiply these two numbers together, 60 and 1,000. So now let's just divide it by 60,000, and that will get us in minutes. So what's that?
5.35.
5.35. Good. So we know it's 5 minutes at least. But now we have to get this 0.35 back into seconds. So 0.35 times 60 equals what?
21 seconds.
21 seconds. So final answer should be 5 minutes and 21 seconds. Let me double check with my other document here. Yep. All right, number 3. Here it says a spin echo sequence. It could also say conventional, but since it just said spin echo, which equation do we use?
TR times number of phase encodings times the NSA.
Good. So let's find what our TR is. Highlight that. 3,000. Remember, TR and TE are always in milliseconds. Your phase encoding steps are the smaller number, 280. And it's 1 next. So it's just 1. So 3,000 times 280 times 1. What's that give us in milliseconds?
840,000.
Okay. And divide that by 60,000.
14.
14 flat.
Mm-hmm.
Okay. And when it comes to 14.0, that just basically means 14 minutes. We don't need to like now convert whatever's behind the decimal into seconds because there is nothing behind the decimal. So you can see here that we rarely do conventional spin echoes anymore because nobody wants to wait 14 minutes for one pulse sequence. All right, number 4. Change the size of the Foxhole in the frequency direction. What will the effect on scan time be? So this 320 is technically the frequency direction. Do we include that 320 in the scan time?
No, it doesn't affect it.
So no effect. It's kind of a trick question. But you'll get that a lot. Things like frequency direction. This could also say here, or TE, or even slice thickness. Those are all parameters they try and throw in there to throw you off. But all 3 of those are not in any of the scan time equations. Number of slices is in the equation, but not slice thickness. So that's why you see up here, I always like to just kind of throw an X through TE, throw an X through slice thickness. You don't need flip angle either. Flip angle is not part of the scan time equation. So they're going to give you more parameters than you need to try and confuse you. Number 5, increasing the number of slices in a 2D acquisition. What happens to our scan time? Tisha's shaking her head. Kind of the same thing, right? No effect. Because that is not part of our 2D scan time equation. But if this said 3D, then yeah, it has a direct effect.